Who else do I see? Yes, I see you all. Thank you very much. Don't be shy. Don't be shy. Just have your friends join us. All right, so now, once again, you are all welcome to the Weekend Health Talk. As usual, I'm your host, Dr. Albert Sedu here. I do this weekly to help reduce the high level of misinformation regarding medical topics. All right, so with friends of mine, specialists, consultants, we do this regularly on weekends to give you as much as possible updated and accurate medical information, and you get opportunity to have free specialist consultation where you get to ask your questions and get direct answers from the experts in the field. Today we have an amazing woman. She's a specialist dental surgeon working at Kollywood Teaching Hospital. She is Dr. Mrs. Christiana Ekia Kwapon-Nyako. She's a specialist dental surgeon, and she's going to talk to us today about teeth whitening and dental caries. I must say, truthfully, I have very little knowledge about this field. That is the truth. So I'm here to also learn, and I'll be piling up my questions to ask all when she is done in the next 20-25 minutes. So, Doc, over to you.
Thank you so much, Dr. Albert. Thank you so much. I'm privileged to share the little knowledge I have with you this evening. So today, my name is, as Dr. Albert said, my name is Dr. Mrs. Kwapon-Nyako, and I'll be discussing teeth whitening and dental caries. And it says all you need to know. I pray I'm able to give you all you need to know in this little time we have. Please, if you can hear me, can you just type hi in the chat box so that I know we are on the same path? If you can hear me, just type hi so that I know we are cool. We are all right. Okay, I can see Nanama, I can see Albert, Dr. Albert. All right, so I guess everyone can. So we start then. So my presentation will take this outline. So we'll first go through the definition and a brief overview of teeth whitening, the causes of discoloration and staining, the whitening techniques we have, indications and contraindications, then the maintenance care after your whitening. Then we move on to dental caries, where I will talk about, I'll give you the definition and a brief overview, causes, symptoms, and management, and then complications, give you a little oral hygiene instructions, and then I open the floor for any questions you have. I pray I'm able to answer every question you give me. So before we start, this is the structure of the tooth. This is actually a molar tooth. So it represents the teeth you chew with and not the front ones. So we have the various parts of the teeth, and I'll be referring to parts as we go on. That is why I'm starting with this structure. So I just want you to take note of the three main parts. That's the enamel, dentin, and pulp. And those are the parts we'll be talking about today. So let's start with the definition of teeth whitening. So teeth whitening or tooth bleaching is the process of lightening the normal color of human teeth. It could be whitening it from a discolored state to the normal color, the natural shade you had, or whitening it from the natural color you have to a whiter color. Okay, so you could have the normal tooth color, and then you just want it to be whiter. You want to have a very white teeth, so you go in to bleach it. Or you have discolored teeth, as we'll be talking about, we'll be discussing later on, and you want to get it white, back to the normal shade. This can be achieved by changing the intrinsic and extrinsic color of the tooth enamel. So it's mainly done by doing one or two things to the enamel part, which is the outermost covering of the tooth. And that is the part of the tooth that actually determines the shade, the color you have in your mouth. So if the enamel is lighter or in translucent, you might have dentin, which is a little yellow, appearing too much, and then your teeth will look a little yellow and creamy And if the enamel is very, very translucent and thicker, you have your teeth being white, like we see in our primary teeth, our baby's teeth. And so when they start losing their teeth and the adult ones start coming in, we assume they are not brushing well, but it's actually a good thing. Like the adult teeth isn't as white as the baby teeth. So that's basically what we'll be discussing today. So a brief overview. Reddish are the eyes more than wine, and the whiteness of teeth more than milk. So white teeth is known as the canon of beauty. And 2000 BC, Egyptians possessed cosmetic healthy white teeth, which actually symbolized health and cleanliness. So in the olden days, people would shape their canines, they would paint their teeth, they would bleach their teeth, and it was a symbol of good health, was a symbol of strength, and it was the main rule for beauty. So you see the picture of this pretty African lady with white teeth. And there was this video recently, a viral video of a little boy crying because mommy wouldn't give him something. And then his grandma started singing to him and he started smiling. And anytime you watch that video, it just makes you smile because it brightens your day. That smile ended a moment of sorrow. That is what white teeth is. That is how important the teeth is to us. So research has proven that over 92% of adults agree that unattractive smile is an important social asset. 88% always remember someone with an attractive smile. 85% agree that an unattractive smile is not attractive to the opposite sex. So imagine a guy walking up to you with a cute face, and then he opens his mouth and then with halitosis and all, a very dark brown teeth. I mean, it repels, it just takes you out. It repels you. And then 74% agree that unattractive smile can lessen the chances of professional success. You walk to this hotel and you see a receptionist, a pretty receptionist with a very brown teeth. And most often than not, these stains and things, they have halitosis too. That's bad breath. So it just puts you off. I mean, it gives you a certain idea. This is a dirty place. This is a dirty person. You don't even want to associate with people with such smile. So the thickness, as I said earlier on, the thickness and the quality of enamel actually determines the color of the teeth. And then the quantity of dentin. So the enamel is very white, and that's the outer covering of the tooth. Then the inner covering, which is dentin, is yellowish in color, it's creamy yellowish. And so the quantity of and color of the dentin reflects through the enamel. So if the enamel is lighter and you have the yellowish color reflecting through, you have it more creamy and yellow, like more broken than the typical white teeth you want to. And the tooth discoloration and staining primarily is usually due to two sources of stains. So you have the intrinsic stains and the extrinsic stains. So when you see someone with the scarlet tooth, it's not just about some stains from the outside on it, but sometimes some people are actually born with these stains and they need to have whitening to correct them so that they get a natural shade. And some people too, due to the foods, beverages, and things they take, they tend to have a lot of stains on their teeth. They have tartar and calculus accumulating on their teeth, and they will walk to you. So anytime you walk to a place, you walk to a professional dentist, they will first speak to you about doing scaling and polishing, cleaning your teeth, because most often than not, it is stains from environmental factors, smoking, pigments, beverages of food, antibiotics, iron supplements, and sometimes copper and things that actually stains the teeth. And it's not that we have an intrinsic thing that it's not as if that is the color of the tooth, but it is these external environmental things we take and poor oral hygiene that results in the discolored appearance of our teeth. The intrinsic stains are usually primarily occurs during tooth development, either before birth or early childhood. So either some mothers are giving antibiotics, especially tetracycline antibiotics, which is well known for doing that. Sometimes too, you have trauma, and instead of seeing the dentist, because it's not so painful, you wouldn't see any dentist or anyone about it. And then bleeding, you have a chronic situation where the pulp tissue, which contains the blood supply to the tooth, tends to bleed. So the iron from these released blood components tend to stain the enamel and dentin. And then sometimes too, with age, the teeth generally appears yellower than it should over time, because you have enamel wearing off. So it becomes lighter with age, and then you have increased deposition of dentin. So it gets yellow with time. So some adults in their 50s and 60s will come telling you, no, my teeth were white, I don't know what's happening and things, and they want to do this bleaching. And so this diagram actually shows the different types of stains you would have. So we have smoke stains from nicotinic stains. So a patient walks to us and you know this patient smokes because of the stains they have in their mouth. You have wine stains, you have food beverages stains from coffee. Every morning they take coffee. So you see them and you know some of them are on some medications, especially blood tonics, the iron stains the teeth. And the herbal medications also do stain the teeth as well. Then, so these three stand for extrinsic stains. And the intrinsic stains are the age yellowing stains I spoke about. You have tooth decay. So you have caries, which is confined in the tooth, probably a chronic state which isn't causing any pain, but you realize you have some darkening of the teeth. Then orthodontic white spot lesion. So ortho is another branch in dentistry where you fix your braces and then you notice some white spots on your teeth. Then fluorosis. So we have mild fluorosis, moderate fluorosis, and severe fluorosis. That is excessive exposure of fluoride to the teeth. So most kids nowadays have it. We are seeing it quite often and we are trying to research into it. But mild fluorosis is we usually won't do anything, but when it's severe and moderate, you want to go in and whiten the teeth or manage. You have amalgam restorations. These are silver restorations we used to do often. Now we hardly do it because of these kind of complaints and mercury poisoning. A lot of research has gone into it. So then the tetracycline stains I spoke about. Then we have genetic issues where the child is born with it. So we have hypoplasia, teeth hypoplasia, enamel hypoplasia, and dentin hypoplasia. They are born with it and they have these stains. And then we have the non-vital discoloration, the one I spoke about earlier on. So for the whitening techniques, we have the non-vital bleaching, vital bleaching, accelerated, light accelerated bleaching, and then the professional scaling and polishing. I'll start with the professional scaling and polishing. So anytime you see a dentist, a professional dentist, and I must say, most people would go in and see a technician or someone who has a little knowledge about dental and not a professional dentist. Before they start any form of whitening technique to you, they discuss any form of whitening, they will first discuss professional scaling and polishing, because everyone has a form of gingivitis, one form of gingivitis or the other, and you have some form of accumulation of calculus or tartar on the teeth. So before you go in to bleach the teeth, you should scale around it. Make sure the stains isn't coming from these extrinsic sources I spoke about. So the professional scaling is basically cleaning the teeth. So I want to clean my teeth. We walk into the dentist and we always say, I want to clean my teeth. Ideally, it should be done every 6 months, but because of our economic problems, I usually tell my clients, if you can't come, my patients, just do yourself that good thing. Just clean your mouth, clean your teeth on your birthday. Do it as a birthday gift to yourself. And it takes a lot of dirt from your teeth. Then the vital bleaching. The vital bleaching is what sometimes we do it in clinic, and then sometimes we do the in-clinic part, and we give you the gels and things to take home. So usually if you're taking it home, we give you a customized tray. Then we give you the gel pen. It comes in pen. It comes in, sometimes we prescribe certain whitening toothpaste and brushes, mouth rinses for you. We teach you how to use it. It contains the chemical, carbamide peroxide or hydrogen peroxide, and it comes in very little percentages. So the percentage is quite reduced because using it at home could cause a lot of problems. And we teach you how to use it. You apply gel on the gums and gingiva, then you put a little in the tray and sit it over a period of time for 6 to 15 minutes or for about 5 minutes. Then you take it off, you repeat it in the house continuously until you get, whilst we do the clinic reviews. The non-vital bleaching is usually done for the root-treated teeth. So usually when you walk to the dentist and you have some discolored teeth, we take x-rays. When they are localized teeth, we take x-rays, examine and see that this tooth is not vital, either from trauma, from 1 or 2 problems. You had traumas years back and you probably didn't do anything about it. So after the root canal treatment, we go in and ask you to either crown it. But usually for the anterior teeth, if the form and everything is fine, then we go ahead to bleach. So that's the non-vital bleaching. Then the light accelerated bleaching is also like the in-clinic bleaching for the vital teeth. So those ones, we use the light to accelerate the effect of the bleaching reagents. So after applying your 25 to 28% hydrogen peroxide gel or paste on the tooth, you use the light to activate it. The light sort of activates and accelerates the effect. So sometimes you start and you get instant results. Yeah. So we give the bleaching. So this is an example of a bleaching tray. And then we have whitening toothpaste, whitening rinses, we have strips and gels we give. So this is what I was talking about. You see the tata in the picture. So that's calculus. So the patient will walk to us and tell us, I want to bleach my teeth. But most often than not, they actually have accumulated calculus on their teeth. And that is what the patient is worried about. This patient doesn't need bleaching, needs professional scaling and polishing. So after the scaling and polishing, you see how neat the teeth are. Of course, has gingivitis, the gums are inflamed. And this, if it continues and patient still doesn't really care, this thing continues in the mouth, it eventually destroys the supporting structures of the teeth, and the patient might eventually lose these teeth. And some will tell you, when I had a baby, I lost my teeth. And some will tell you, I have bad breath. It smells a lot, and these things cause it. It contains a lot of organisms in them. When I get to caries, you know that it's actually the hub for the bacteria that causes caries. So why do you do it? When should we do bleaching? When should we bleach our teeth? So it's usually taken for a number of reasons, as I mentioned earlier on. So intrinsic staining. So when patient comes with tetracycline stains, severe fluorosis, you have to bleach because aesthetics is something important. It helps with the mental health of patients, and people with these kind of teeth can't even go out. They can't socialize because it sort of brings down their self-esteem. And with aesthetics, it gives you a very good smile. So, and dental fluorosis, then the endodontic treatment I spoke about, then the tetracycline thing. So that is the main indications for bleaching and tooth whitening. So some people might have the normal color, but they just want to make it a little whiter. They want to make it a little nicer, maybe for their wedding, for their program. fine, we go ahead and do it for them. Then when not to do it? So the main reagent we use is the peroxides, and in different varying percentages. So if you are allergic to peroxide, don't do it. And if you have sensitivity, pre-existing sensitivity, so most people have teeth sensitivity, probably from the second layer of the tooth, that is the dentine, is actually very sensitive. So if you chip the enamel, which usually doesn't give any issues, if you have any crack line or the slightest chipping on the enamel exposes the dentine, which is a sensitive layer, and it's quite unbearable to have tooth sensitivity. So most often we put such patients on certain toothpaste to help them with the sensitivity. So if you have it, because bleaching will only make it worse, please don't do it. If you have cracks and exposed dentine, don't do it. If you have enamel developmental defect, so if you don't have a complete covering of the enamel on the tooth, don't do it. It's the same with the acidic erosion. So patients with gastroesophageal reflux disease and certain diseases end up having erosion, that is tooth wear, and they erode the enamel of the tooth surfaces and expose the dentin. Please don't do it. Then receding gingival recession. So the tartar I spoke to, the calculus I showed you earlier on, usually causes recession of the gingiva. So the gums move away. So you notice that your teeth are getting abnormally longer than they used to be. And then the lower part, the border that's actually close to the teeth looks yellow than the normal. That is actually the roots of your teeth. That is what is holding your teeth in your mouth. And the yellowish part is the color of the root. You cannot bleach that part. If you go bleaching it, it will only get sensitive, and you might not love your teeth again, so leave them. And if you have gingivitis sensitive gums, please don't do it. So restorations, if you have a large tooth decay in your mouth, caries, dental caries, cavities in your mouth, fix it. If you go and see an unprofessional person or any business person who has decided to do dental whitening as a business person, they won't ask you about all these things. They won't do any proper explanation, and they'll go ahead and bleach for you. But a professional person will examine and make sure you don't have any of these issues before going into bleach. Untreated periodontal disease, pregnant women and lactating mothers, please stay away from it, because you already have some form of severe gingivitis and periodontitis, so you don't even have to go there. And children under 16 years, these kids can't really decide for themselves. So we don't do it for them, because one way or the other, it could be from peer pressure, and most often too, they have wider pulp horns. So when you go into bleach, the pulp chamber is where the vessels of the teeth are. The bleaching reagent, one way or the other, gets to irritate the blood vessels where the pulp chamber, and it causes a lot of problems and eventually causes pulpitis, infection of the pulp, and you don't want to take any child through it, so we don't do it. Patients with restorations, crowns and bridges, please, we don't bleach them, so you cannot bleach them. And if you are an individual with poor oral hygiene, as I said earlier on, yours is to keep good oral hygiene and do professional scaling and polishing, no bleaching. So with the side effects, we have hypersensitivity, and that's a problem. We have hypersensitivity. That is why if you already have this, there's no need going in for bleaching. Your teeth become sensitive with time. Then it could irritate the mucosa. If you spill the reagent into the oral cavity mucosa, that's why we usually protect the gingiva and gums with the gingiva with a gel, a Vaseline gel to sort of coat it and prevent any damage to it. Then the pulpal irritation I spoke about, we usually see it in kids. Then in the patients with very worn down dentine. Then if you have severe tooth wear, damaged enamel, weak dentin, please don't do it. And it becomes a habit. So instead of keeping good oral hygiene, they go in bleaching and bleaching and bleaching because they have a whitening toothpaste, because they have access to the gels and reagents. They just go in bleaching and bleaching and eventually over bleach. And then we have bleachorexia. So some patients will not go out if they haven't bleached their teeth this month. They want to do it every time. And then it has a lot of effects on existing restorations. So if you have a lot of cavities and dental fillings in your mouth, it's not advisable to do. What you have to do is, after bleaching, you have to maintain your mouth. You have to maintain it. If we bleach and you go back to your coffee, you go back to the smoking habits, you go back to poor oral hygiene, you just keep bleaching because you are not doing anything to maintain it. So this is a picture of a patient flossing. You floss in between your teeth to get rid of food particles that cannot be taken out after brushing. The brush couldn't get in between the teeth. So you use the floss to get these things out. In a setting, most people, instead of flossing, would use toothpick. And I don't advise toothpick because the neatly curved gums in between your gingiva gets damaged. That's the dental papilla. They get damaged as you use the toothpick, which is quite bigger for the interdental spaces. So for the dental floss, it's so tiny and it's able to clean in between. And then you brush twice daily with a soft to medium brush, not a hard brush, please. A hard brush is for bathhouse and towels and things, and it's not for the mouth. The teeth and the gums are not so hard that you use the hardest brush and brush with all the strength you have. It's just brush as slowly as you can. It's just time, you need all the time to take out the debris from your teeth. So you brush and floss out debris from your mouth. And usually the first 24 to 48 hours whitening procedure is the crucial period because you have to take very good care. I mean, after bleaching, if you go back to the drinks, these drinks, so below, you go and take palm oil and things, the enamel rots will, it will stain again. You end up staining, the enamel will adhere to these things, and whatever you did becomes, excuse me to say, useless. So the first 24 hours to 48 hours, usually the first 2 days, we advise that you stay away from certain foods. And if you just can't do without it, you have some medications you have to take, you can do that. You can take them with straw and not expose them to the teeth in your mouth. And depending on the kind of methods you use for the whitening, you might have to retreat every 6 months. Ideally, every individual should visit the dentist 6 monthly. If you can't do it, just try and pass through weeks before your birthday or after your birthday to treat yourself, clean your mouth, clean the gateway to your body. Everything you take to your body passes through that side. So if it's dirty, it equates to what you take into your system. Before I end tooth whitening, I just want you to know that the adult teeth isn't as white as snow. A beautiful and a healthy smile is the ultimate goal. So that is one teeth. The patient has a lot of extrinsic stains, but it's just coffee stains and nicotinic stains and calculus. The scaling and polishing, it doesn't look so white, but it's beautiful and it's fine. And that is another teeth yellowing with age. Patient bleaches it and still has a beautiful smile. So don't force yourself to get that whitish, snowy-like teeth. So far as you have a healthy smile and the teeth has its natural color, you are fine. So we move on to dental caries. And this, I have a beautiful chart here, which actually shows the stages of caries. So you have a healthy tooth, then an incipient cavity, then it keeps going on. So for the first 3 stages, most patients will say, is not painful, so they will never visit. They won't come. And then even when it gets painful, they start doing they have a lot of local dentists to give them instructions until it gets to this stage. And then you see them very early. They walk to the dentist at dawn. They start talking to anyone in white coats because they couldn't sleep. Yes, dental pain starts at night, usually at dawn. It will destroy your sleep if you don't attend to it. So dental caries, also known as tooth decay, is a multifactorial microbial infectious disease characterized by demineralization of inorganic structure and then the destruction of the organic substance of tooth. So the tooth basically has two components, the inorganic and the organic. It demineralizes the inorganic structure, so it becomes brittle and soft and starts coming off. And then the organic substance, it destroys it. So you have that big hole in it. So, and the microbial aspect is not because you are taking sugar or you are taking toffee, so you have caries, as our mothers made us aware. So if you eat a lot of toffee, you get caries, tooth decay. No, first of all, you need, so this is what dental caries is about. It's not because of your diet, and it's not because you have bacteria in your mouth, and it's not because you have teeth in your mouth, and it's not because of the environmental factors leading to your poor oral hygiene. It is a combination of all these factors that results in dental caries. So you should have a tooth in your mouth, so you don't have someone without teeth complaining of tooth decay or dental care. You should have teeth in your mouth. And you should have, whether you like it or not, you have some kind of normal flora in your mouth. Strep's mutans is always in your mouth. You have tartar in your mouth so far as you eat. And you have these organisms in your mouth. Even if you clean and clean, you still have some form of normal flora, which is always there. So you have it in your mouth. Then the kind of diet we take. So the sucrose, glucose, and fructose are able to, the bacteria works on it. So anytime you have these carbohydrate diets, so it is carbohydrate. It is not just the sugars. It's not just the toffees. We have a lot of foods containing carbohydrates. Any food that breaks down to glucose has the potential of causing tooth decay. So you have patients walking to you and saying, I don't eat toffees, but I have tooth decay. No, it is carbohydrates. And the frequency of taking it, so is the time. Every 5 minutes, you go on to snacking. You keep snacking every 5 minutes, every 2 minutes. You, after eating, spouse watching TV, you start eating chocolates, you start taking a lot of sweets in between. So patients who snack a lot tend to have these cavities. And then poor oral hygiene. And so if you have very low fluoride exposure, you have certain enamel defects in your teeth and things, you are prone to these cavities than the ordinary patient with healthy teeth. So it's a combination of all these factors that brings about the cavity. So this is just the role of carbohydrates, microorganisms, the acids, and the dental plaque. That's it. So with the tooth decay, we have it in stages. You have when it's just in enamel, and even if it's advanced, a little advanced in enamel, it's still not painful. And at this particular stage, you just see a discoloration, a white spot on your enamel. So sometimes it looks a little brown, but it's really not painful. So you won't come. And that's why we advise that at least every year, visit the dentist. When we pick it at this stage, we just do our usual filling for you at this very stage. Then this stage 2, we do the normal dental filling. So you have our composite restoration, amalgam restoration. I'll show you pictures of that. Then when it gets into dentine, that is when it becomes painful. But this kind of pain is intermittent. So whilst chewing, food enters there and you hold your jaw. It's so painful. And as soon as you get your toothpick to pick out the food, you feel a little better. And most patients, as stubborn as we are, will avoid chewing on that side. As soon as you avoid chewing on that side, it becomes a recipe for disaster, because the caries will progress faster than it should. And caries in dentin progresses very fast. So it progresses as fast as it can. And then it goes into the pulp where the blood vessels and nerve supplies are. And at this stage, it gives you sleepless nights. At this stage, you feel the pain in your ear. You feel the pain in areas where you don't even assume is coming from your tooth. And that is when we run to the dentist. But unfortunately, here you have only two options: to do the root canal treatment. Even with the root canal treatment, it depends on the structure of the teeth at presentation. Or the other option is to extract the tooth, take the tooth out. So for the incipient lesions, when it's just a spot on the enamel, we give you oral hygiene instructions. We make sure you reinforce that. And then we review the patient, and the tooth it works as soon as you reinforce your oral hygiene. It remineralizes on its own. Then we do our dental restoration. So that's an amalgam restoration neatly done in the patient's mouth. This is also a type of restoration, composite restoration. So after composite restoration, you don't even see, the tooth looks so beautiful. So most patients would want the composite restoration, but I must say amalgam is very good and strong as well. Then we do, for the damaged teeth, when it gets to the pulp, we do our root canal treatment. After root canal treatment, you have to crown the tooth or put in an onlay. Sometimes the cavity destroys the tooth completely, but we try to salvage it. So we put large fillings on it, and these are the preformed onlays and inlays. So we put them in. Then the other option is to take out the tooth and replace them. Sorry for the break. So a patient will say, why not? I'll just take out my tooth and replace it. Please, it is not cheap to replace. It is not cheap. It's very expensive. And some will say, I'll leave it like that. So this is the normal anatomy of a patient. Then when you move to the next, patient has lost a number of posterior teeth. You start getting bone loss. So you look older than you ordinarily would look. You look quite older than your age. And then when you have complete tooth loss, this is how you look. And replacing a missing tooth is quite expensive. An implant is like $1,500 to $2,000 now. Bridges and crowns are now $6,000, $9,000. Even a crown is $2,000. So let's try to maintain and prevent these cavities as much as we can. What are the complications of tooth decay? So if you have it and you have the persistent pains, you won't come. You have spreading infection. So from the initial picture, you notice it's actually spreading to the local spread to the bone. So it spreads to the bone, and still you don't do anything. You put in, some go straight to understand that they actually put in painkillers in the cavity. Fine, you think you have a lot of toothache, you will come. It starts spreading to distant tissues. So you have it spreading along the fascial spaces. You come with necrotizing fasciitis, noma, you have oral abscess, and eventually respiratory complications, because this swelling will obstruct your trachea. And the most often than not, we see it often. Friday afternoon, you see patients coming with breathless, the whole place smelling bad odor, and we lose them. And the sad thing is to say that we lost him. So relatives will say, oh, he had toothache, they took the tooth out, his head got swollen and he died. No, he had Ludwig's angina. So the patient probably came with Ludwig's angina. So this is a complication of toothache. So you see the discharging sinuses, you see the fascia, inflammation of the fascia spaces. And that's how the swelling appears. So it blocks the trachea, which lies right here. You become breathless. Your mouth, when they open their mouth, you notice the raised floor of the mouth. filled with pus, you get breathless, and then we eventually lose our patients. Oral hygiene instruction, what should I do? It's quite easy. Visit your dentist regularly for just a normal checkup. Clean your mouth. We pick up these incipient lesions as you clean your mouth. Sometimes we feel them, and when we are saying goodbye, we tell you, oh, I feel the cavity. It's fine. Brush your teeth at least twice, 2 times daily. In the morning before you step out, and the last thing before you go to bed. And in doing that, we forget about our kids. Ensure that they do so as well. You teach them how to do it, and then monitor them, especially in the evening. Most often in the morning, you are leaving for work, you are late. But then in the evening, try and guide them through it. Do it for them. Those younger than 10 years, try and do it for them every day. Floss after every brushing, and then brush your tongue. Choose a toothpaste with fluoride. I won't tell you take this toothpaste on. So far as it has fluoride, we are fine. You use a mouthwash. Don't use it as I use the mouthwash. I didn't brush my teeth. And it shouldn't be your regular thing. When you clean your teeth, your dentist will prescribe it for you for like 2 weeks. You just use it for 2 weeks and you are fine. Okay, then hydrate your mouth. This is a very good way to stay clean, to keep good oral hygiene. After taking any sweet, any sugar, use water. Use water to just clean your mouth. Use it to clean your mouth. Feel fresh, because so long as the sugar stays on your teeth, you have the bacteria working on it, and then they produce lactic acid, which causes in the tooth decay. So if you rinse it out of your mouth, you don't have any sugar in your mouth. The bacteria stays cool, your teeth is fine, and everyone is happy. Then you eat a lot of fruits and vegetables. It's healthy for the body. Reduce the sugar, the glucose content, the fructose content, and sucrose content in your diet. Take more veggies, and then, as I started with, visit your dentist regularly. I'm done. Questions and answers.
Thank you very much. Thank you very much, Dr. C.S. Nyarko. Thank you, CSK Nyarko. Yes, CSK Nyarko. Thank you very much. We appreciate the in-depth, and I enjoyed the teeth whitening. A lot of people say it's good, don't do it. Some people say do it. I'm glad it came from an expert, that there are indications, reasons why it has to be done, especially talking about self-confidence. There are people whose teeth may be brown, dark, and just because of that, they can't open their mouth when they are talking. They don't have confidence, and that's a lot. It affects your mental health a lot, and that's my space. So I know how much that can worry a lot of people. And of course, I'm happy that you're able to tell us specifically when it should not be done. That's a very good. And talking about toothache leading to someone's death. How? Just a toothache, yes. You've heard from the expert. It leads to complications, Ludwig's angina, blocking your airway, and then somebody will say it was just toothache. Oh, this one is house people. It is a fearful. It is not a fearful. It is yourself. You didn't do what you had to. That's why we have platforms like this to help people have accurate medical knowledge. Now it's time for questions and answers. Please feel free to put your questions in the comment section, in the chat box. I'll read it out to Dr. CSK Nyarko, and she'll gladly answer all for you. This is like free specialist dental surgery consultation. When was the last time you saw your dentist? And when I went to my dentist the last time, I was surprised. The advice was simple. Use soft toothbrush, brush normally slow, don't rush it, so that you don't hurt your gum. You'll be surprised. Some of us think we have to use hard toothbrushes and you have to brush aggressively to make sure. No. Just be gentle with it. That's advice my dentist gave me. When was the last time you saw your dentist? It's an opportunity to see a dentist right now. Ask all your questions now. Please, the floor is open. Questions and answers. Those on YouTube, put it in the chat, but in the comment section. Those on Zoom, put it in the chat box. I'll read it out, and Dr. CSK Nyarko will gladly answer all for us. I learned a lot, and it should scare you that toothache, if not taken seriously, can result in losing a life. So that should tell you something very, very important. And I like the fact where she brought in the oral hygiene bits. It's very, very. Now my question is, you said we shouldn't use mouthwash too often. Is that what you said, Doc?
Yes, please.
Is there any reason? Because I see people use mouthwash every morning after brushing their teeth. Is it advisable?
Yes, so most people tend to replace it with proper toothbrushing. what we want you to do is toothbrushing. And most often, mouthwash is an adjunct to dental gum treatment. So after your scaling and polishing, we prescribe it for you. And then it works in the gums. That is how the mouthwash containing chlorhexidine does. That is what it does. But when you use it, it's like spraying a dirty body. So you have calculus and tartar in your mouth, and you are just using the mouthwash because you have it at your disposal. Another problem is chlorhexidine, which is the major component of most of our mouthwashes, causes tooth discoloration. So you go and whiten your teeth, and then you still go back to the chlorhexidine and you use it. Prolonged use of chlorhexidine will eventually result in tooth discoloration. So you have the yellowing of teeth and you don't know where it's coming from, but you think you are all good because you are using a mouthwash. So that's why we don't advise. Usually after 2 weeks, you go back, you see your periodontologist, they just assess the gums. If you are fine, fine. There's no need to using the mouthwash again. Some with issues would be asked to use it for like 6 weeks, 3 months, fine. But if you don't have a problem, it's really not necessary.
Okay, so what you are saying is routine use of it after brushing your teeth is not advisable. But if somebody does it, is it wrong?
It could cause tooth discoloration. And okay. I think you should just focus on the brushing and brushing well, but not the use of mouthwash. Sometimes when you have halitosis after scaling and polishing, so we usually use these rinses after the S&P, the scaling and polishing. And that is when you have it, you get the proper use of it. You achieve what you want to achieve. But the routine use of mouthwash, you are just buying it and rinsing your mouth for confidence, but not doing anything.
Doctor, there are 2 questions I'm going to ask you, but just as you brought it, I'm going to put you on the spot. We will be asking you to come back and share with us on halitosis, bad mouth odor, the causes and how to go about it. It's a big thing, but not now, but we are just putting it out to you. I'm just putting you on the spot. We'll be asking you to come back. Over here, when you come here and you do so well, we always ask for more. That's what we do here. Thank you very much. Now, somebody's asking, what type of mouthwash chemical is recommended?
Okay, so for the mouthwash, any mouthwash containing chlorhexidine is fine. I personally use for us in the clinic setting, I go in for Posodil or Camaclus because it works for me. It works for my patients with halitosis. But so far as it has chlorhexidine, there are a lot of formulations in town. I haven't researched so much into it, but I do know that Posodil mouthwash, Listerine, and Camaclus have chlorhexidine. And that is the major ingredient we want. So far as it has it, yeah, fine, you can get it. But if it hasn't been prescribed by a dentist and you have good teeth, I seriously don't think you should use it. And you don't have halitosis, I don't think you should use it.
All right, the 2 you mentioned, I know one of them. That's why I was celebrating. Now, somebody asked, averagely, how much does it cost for teeth whitening? Averagely, how much does it cost?
Oh, okay. So for teeth whitening, it varies. It varies depending on the one you see. So it varies in the government sector. Even in the government sector, we have varying prices. So on the average, it would be 500,000 cedis, 250 when it's localized or for just a set of teeth. So it varies. It depends on where you go to. In some areas, sometimes we charge quadrant by quadrant. So we divide the teeth and then we charge little by little and we do it in sections. So you could pay like 250, 500 cedis for a section or something. Then sometimes if you want to do the full mouth and it's light accelerated, it'll be like 300, 600. So it varies. It depends on who you see and who you speak to. Yeah.
Yes, it depends on who you see and where you are doing it. There's some administrative charges as well. If it's a private clinic, you expect to pay more because of the services and all that. So yes. Now there are questions on YouTube. Somebody is asking, Doc, I know you didn't want to recommend any particular toothpaste out of professionalism, yes, but what does those color coding on the bottom of the toothpaste mean? Should we be mindful of them?
Color coding on the bottom of toothpaste. Well,
Yes.
I haven't noticed that myself, but
Oh.
I know now we have a number of them in town. So for so far as it has fluoride, we have some specific toothpaste for sensitivity. So for tooth sensitivity, you would want to go in for Pepsodent sensitive. You want to go in for Sensodyne Oral-B oral protection. Those ones are specifically for sensitivity. So patients with sensitivity, we prescribe that for them. For the others, you read if it has fluoride, that is what we are concerned about. So if it has fluoride, you can go in for it and you'll be fine.
All right. Somebody is also saying, let me see. Scaling and polishing, how much does it cost?
Okay, so for scaling and polishing, it also depends on what you have in your mouth. Some will come with a lot of calculus. You sometimes you have to scale in a period of like 2 weeks. So you scale it every other Tuesday. Sometimes 6 weeks, you are just treating one patient for scaling and gum treatment. And those ones, the specialists, we have a specialist, we have specialist periodontologists who see such cases. But the ordinary scaling and polishing, we grade it from mild to severe. So for the mild, you pay 200, then 300, then 400, depending on what you have in your mouth. And some of the clinics, I know my place in Kolebu, you have health insurance taking almost like 90-something cedis off it. And then you have a free folder. So you end up paying 150 or something, lesser than 150. And if you have moderate, you pay. So depending on what you have, yeah. But on the average is below 500 for most places.
Yes. So mind you, the figure she's mentioning is from a public place like Kolebu where there's a long queue. But if you go to a private place...
No, please. There's no long queue as Kolebu.
Oh,
there's
okay.
no long queue as Kolebu. So we have a lot of patients. Yes, we see a lot of patients, but we have a lot of specialists, and we do our treatment strictly by appointment. So we give you the appointment, you come in, and you actually have the time to come. So you know today at 10 o'clock, you are seeing Dr. This. Today at this, you are seeing the restorative team. And we sit there and know that you are coming. We actually give you a number such that if you can't come, you call us and we reschedule you. So you don't just come and sit there. You come and see a lot of patients, but each and every patient knows where they are going to and who they are seeing. So we work as fast as we can. Please, there's no long queue.
That is why it's always good to talk to the expert too. When you come to the dental clinic, you see a lot of people sit there, so you might assume it's a lot of people going to just two doctors, but you see, she's clarified it. That is why we all need to speak to experts and not just what we think. Somebody's asking that, you said we should have S&P every 6 months. Is that what you said? That's what somebody's asking.
Yes, please. So ideally, scaling and polishing is done 6 monthly. It's a 6 monthly affair. And so far as you eat and you have teeth in your mouth, you accumulate it. So even as we are speaking now, you can just take your hand and pass it through your teeth. You can just pass it on your teeth, the molars. You see black tartar. You see some creamy whitish substance on your teeth. So you accumulate it every now and then, and it gives bad breath. So if you can do it 6 monthly, fine. But if you cannot do it 6 monthly, a birthday gift to yourself. We do all these photo shoots and things. It's not healthy. You have to, a healthy body is a healthy soul. So a birthday gift to yourself, at least for your partner, to give your partner a good kiss. So come and clean your mouth as a birthday gift to yourself.
I like the birthday gift thing. So every birthday, you remember to go and have your teeth checked and cleaned and all that. Wow, that's a very smart way. Now, somebody is asking a very serious question. Doc, I have extracted both lower molars some years ago, but I have started having pains with my right lower premolar. Meanwhile, I brush my teeth twice every day. What do I do, please?
Okay, so for pains. So the pains you are having now is in a different tooth altogether. And since you've had some extractions, I'm sure you had some cavities in the past and things. I would advise that you visit the dentist, just explain things to them. We examine it, we pick up, sometimes it could be cervical abrasion, some tiny abrasion causing some kind of pain and sensitivity. We will just go in and sort it out. And please do it as fast as you can before it gets worse, because you don't want to lose your premolar as well. And if you lose your premolar, it's not good. It gives you a very poor smile. So visit any dentist close by and then sort it out as soon as possible.
All right. Somebody is also saying that, yes, we should feature you back to have the talk again on another topic. So I'm just telling you that it is not only me who is saying it, too. Other people are also saying the same thing. Because for us here, when you come and you do well, we always ask you to come back. And we are happy you did great with us. Somebody is asking, how do you care for artificial teeth?
How do you care for artificial teeth? Is that it?
Yes.
Is that the question, please?
Yes.
So for the bridges and crowns, usually we have a lot of artificial teeth. So we have the removable dentures and then the bridges and crown. So after we give it to you, we give you a set of instructions. So the bridges, we tell you to remove it every evening. Don't sleep with it. Keep it in water. When you wake up in the morning, use your liquid soap to clean it nicely. Rinse it under running water, and then you insert it after brushing your teeth. You do it every day. And we have denture cleaning tablets. You put them in water like every other 2 weeks or every other week. You use it to disinfect it. Then for the bridges and crowns, we have interdental brushes, we have super floss. So we have a type of dental floss known as a super floss. So we sell them in the dental clinics, which we use to clean them. But you can brush around it as your normal toothbrush, and you just brush everywhere. But the bridges, you need the super floss and interdental brushes to clean around them properly. So you can get some from the dental clinics.
All right, so what she's saying is just get back to the clinic and let them know what it is, the instructions that you need, and what you need to carry out those instructions adequately to do what you have to do. All right. Now, somebody is asking questions. Say, Doc, I have noticed that my two front upper teeth are cracking gradually. I mean, the part that is exposed to people seeing. What do I do?
Okay, so for cracks in the teeth, it's quite common. You see it with age because you are using it to chew. So you chew all sorts of things and you expose your teeth to a lot of things. So one, you should watch your habits. Watch your habits. So if you use it to hold some tailors, designers will use it to hold their pins and things. It chips the teeth. Some will go for parties, and before they bring the openers, they use it to open bottles and other things. They use it to chew hard bones. And so these are the habits that actually causes cracks in the teeth. On a few occasions, I have heard patients say, whilst chewing beans, there was stone in it, there was this. So in the kind of foods, these brittle foods we eat and things, we should just be careful. Those causes the cracks in the teeth. It's normal to have them, but when you start experiencing sensitivity, or if you notice any mobile parts, or if a part chips off completely, kindly visit the dentist for us to restore and then deal with it. Because as soon as it gets sensitive, it could go on and on and on and eventually cause pulpitis, which you can't bear. You end up getting a lot of problems. So if you have this sensitivity, kindly visit the dentist and let's sort it out for you.
All right, if today is your first time watching us live because a friend has invited you, please do well to subscribe to the YouTube channel so that you stay connected and be updated on any upcoming presentations. There are a lot of recordings on the channel as well. We do this regularly on weekends where we host a lot of specialists to come and deal with topical issues. Today we are talking about teeth whitening and dental caries. We just learned that toothache can lead to loss of a life. We also learned that there are conditions that will make a person have to do teeth whitening, that is tooth bleaching. It's very medically advised on certain conditions, and there are times that you are not supposed to do them. The best way to do them is to make sure you visit and see your dentist. In Ghana, for example, generally, Most of us don't like to see our dentist. That is truth. Most of us don't. The question is, when was the last time you saw your dentist? It's question and answers time, and a lot of questions are coming in. Another question is this, that the use of plantain peels and charcoal to clean the teeth, as we see on advert, is it equally good?
Yeah, it's equally good. So in the olden days, I've used some before. Our mothers used to do it. We won't say it's not good. It's good. It has an active ingredient that helps, especially with charcoal. But don't throw away the brushing. I mean, you can do it, but use it as an adjunct to your toothbrushing. The reason being that the brush is able to go onto the occlusal surface and the interdental spaces, the spaces between each teeth, the teeth, it goes in between them and it cleans them nicely, which your plantain and charcoal can't go there. It can't actually clean those areas as you want to. That is why we ask that you use it as an adjunct to it. So after brushing, you can add that to it just to boost your confidence and spice up things.
All right, so those of us who are joining us not too long, please don't worry. We are going to have the full recording posted on the YouTube channel. I've shared a link in the chat box on Zoom. Feel free, subscribe, and most importantly, put the notification buttons on. Very important to put the notification button on so that anytime we come on live, I'm beginning to host other programs as well. Anytime we come on live, you are notified and you join us for free consultation, free specialist consultation anytime as well. Mr. Isaac Yanteche, you want her number? No problem. Go to my YouTube channel. You'll get my number there. Chat me on WhatsApp. I will seek her permission and then I'll give you her number as well. Doc, I want to ask, those who chew sponge in the morning, there are people I know in Accra here and other places. All they do is they chew sponge like the better part of the day. And that is their brushing of teeth. What do you have to say about that?
Yes, it's good. It's actually part of our oral hygiene instructions. So if they chew it, is fine. But as I said earlier on, we will always advise that they add it to the brushing. So I mean, if you are chewing it in the morning, in the evening, try and brush, or even if you brush a little and add it to it, fine. If you add a little toothpaste to the sponge and chew, and make sure you chew, or if you floss after chewing the sponge, fine, so that you get all the other unexposed areas cleaned properly. But chewing stick, chewing sponge, the plantain and charcoal are all acceptable methods. So I just that you have to do the toothbrushing a little to get the interdental spaces and occlusal spaces, these areas cleaned properly.
So from what you are saying, what you are telling me is that it's not enough to use the chewing sponge or the chewing stick alone.
Yes, please.
What you are advising is to add the brushing.
Yes,
compulsorily. We have to add the brushing, right?
Yes, please. And the brushing too, we brush too hard. It is not a fight. We are not fighting with our teeth. I mean, it's not about the how hard you brush. It is the time. So it's like cleaning a stain table with foam. If you use a bread knife to clean that same stain, it will scrape off the surface of the table and you end up cleaning it as well. But if you use a foam, you will clean it neatly and still get the structure of the table intact. So we want the medium to soft brush. You use the medium brush with a little space. You clean it gently, go through the motions, you brush in circles, clean the chewing surfaces, brush your tongue, and you are good. Don't fight with your mouth. Don't fight with your teeth. Okay. We end up causing cervical abrasions and sensitivity when we do that.
Thank you very much. Doc, I must confess, a lot of people in the comment section are happy with your presentation and they are saying Doc must come back. Yes, so please, it's not me, it's the people. You know, you did so great. So yes, a lot of people are appreciating. Now, I want to just watch your comment again. I know you touched on it, but I want to bring it back. I have done it before. Using my tooth to open bottle. I mean, you know what I'm talking about. What do you have to say?
Please come again. Using your
tooth to open, drinks, bottle.
Please, it is not good. Please don't do it. You crack them, especially the premolars. So the premolars are not as strong as the molars. And fortunately or unfortunately, those are the teeth that we use for these habits. So we don't want you to break them. We don't want you to crack them. I didn't bring it, but I have a picture of a cracked tooth, and it's devastating. When you come, you can't sleep. I mean, if you break, it results in cracked lines, crazed lines, and then it eventually opens up. And as soon as you lose your premolar, you are losing the contour on your face. So you start looking older than you should. And it's quite expensive replacing a missing tooth. So let's not do it, please. You can get a bottle opener as a key holder. If you like going for parties like I do, keep it in your bag so that anytime they give it to you, open it sharp and then you use it to yourself.
You see, that's the beauty of it. That's why this channel exists, to talk to experts in the field. So you heard from the expert. Let us all stop, including myself, using our tooth open bottles, Coke bottle, Fanta bottle, beer bottles. Let's stop it. It doesn't show that you are strong or anything. Let's stop it. If you like attending parties like she does, have an opener as a key holder in your bag or pocket or wherever. All right, very, very important. Thank you very much. There's another question. Do you brush across or along the teeth?
So it's either you brush along the teeth, or maybe in the next session I'll teach you how to do it. So I'll put a video up. So we brush in circles. So along the gum, the contour of the gums. So you go in circles, you put your teeth together and go in circles along the contour of the gums. So you realize the gums are in circular, semicircle shape. So you brush along that, or you brush up and down. You just brush up and down. So you don't brush across. As soon as you brush across, you disturb the dental gums, and then they wear off and you have a lot of issues. So you appreciate it better when it's in a video, but I'm sure you can picture it. Just brush along there.
Yes, I can picture it, but I'm not getting it too clear. So what it means is that she has indirectly, some way, somehow accepted our invitation for the next presentation on oral hygiene and halitosis. Oh, thank you so much, Dr. CSK Nyaku. We appreciate you for accepting. So please, all of you, subscribe to the YouTube channel, put the notification buttons on. She will be back in some few weeks to come. Thank you very much. Any other question? Last few minutes, we're about to go. Any other few minutes, any other comment, any other questions, please. She's still on standby to answer. It's free dental consultation here. Dr. C.S.K. Nyaku. All right, thank you very much, every single one of you. If you have not subscribed yet, just take the next 5 seconds to subscribe to the YouTube channel. I've shared it on Zoom, the comment section. And if you're already on YouTube, just click the subscription button. And most importantly, all of you have subscribed already, put the notifications button on so that when next we go live, you are notified wherever you are, and then you join us. Thank you very much. Put your questions across. She will be back to answer all your questions for every one of us. Thank you very much. Thank you very much. We'll be ending the session shortly if there are no questions. This has been very, very interactive. I learned a lot. I learned a lot from all that she shared with us. That's the beauty and the reason why. This channel exists, so that we get to interact with lots of specialists in their individual fields. And when you hear specialists talk, if somebody ever told you that somebody can have and the person's deaf, you argue all day, all night. But you come to hear from the experts telling you toothache not taken care well can result in a complicated condition called Ludwig's angina that can become an emergency, and we might lose the person. All right, so, and she gave us a bonus, hygiene. And in that, we got a topic, halitosis and oral hygiene. So she's going to come in a few weeks' time, going to share with us on how to brush our teeth. All right, she's going to come back to share with us how to brush our teeth. She's going to come to share with us. Okay, is that you? Let me get her back. That's Sawa Boateng. She dropped off briefly. I'm sure that's her. Doc, is that you back as Sawa Boateng? If that's you, let me see.
Yes, I'm here. I'm here.
Okay, thank you very much for coming. So there was a question. You saw it. Please, can you answer for us?
Was it a question about the veins?
Yes, someone asked me that is the veins of the teeth connected to the ear?
Yeah, so it's not the veins, it's the nerve. It's the nerve. So the dental nerve supplying the teeth in our mouth is a very huge nerve. The ganglion actually lies just in front of the ear. So it branches to the teeth, the eye. So we have the trigeminal, there is a fifth nerve, then the trigeminal goes there. So just like how you get a sore on your toe and you have a referred pain to your joints, your groin. Yeah, it's the same thing as you have in your ear. So sometimes you don't even know what you have in your mouth, but you have persistent ear pain. And that's why we work hand in hand with the ear, nose, and throat session. So they refer, we assess, and then we see something in the mouth causing the pains in the ear. So it's actually the nerves that does that. And it's a referred pain.
It's been a beautiful session. It's been very informative, very, very well laid out. It was clear, clean, and everything. And all of us enjoyed it. And for the first time, our guest speaker has agreed and accepted our invitation to come again. Oh, thank you so much. Yes, this one was my people. Yes, somebody said, yes, there's a particular man who has asked a lot of questions. He said, Mr. Tonyenyo Day. He said, Doc, we need you back. Doc, that's what they are saying, not me. It is because you are good. All right. Okay. Any more questions? We have 30 seconds to go. Any more questions? Doc will be back. She's accepted. She will be back. Yes, she will be back. Any more questions, please? She's willing to answer last few questions, last 30 seconds. Last 30 seconds. Any more questions so that we can end it? It's been a very informative session. I'll get a recording. Please, if you have not subscribed yet to the YouTube channel, please do so now. There are lots of things on the YouTube channel currently, and there is more coming in a few weeks. Lot. You'll be hearing from a lot of people, different topics. Next week, I'll be having a senior specialist gynecologist, and we're going to be talking about PCOS next week. So you don't want to miss that. If you have a girlfriend, you have a wife, you have anybody, just get them. All right. All right. So thank you very much. So anyone who wants to have a number, I'll ask her privately when the call is over if she's okay. Chat me on WhatsApp. If you want to get my number, go to my YouTube channel. In the description, I leave my number there. Get my number. Chat me on WhatsApp. I'm not too good with calls. Chat me on WhatsApp, and I ask her permission, and then I can give you her number if she allows. It's her privacy. She decides. All right. So that one I cannot vow. For putting on the spot about coming back. We are friends, so I can put that in her stylishly. But asking for her number openly, not yet. I'll ask her privately. If she gives the go ahead, I'll give it to you. All right? Yes. Any more questions in the chat box? Any more questions? Any more in the absence? Doc, your final words to us this day.
Okay, so I just want you to know that most often than not, people tell us that dentistry is quite expensive. So I don't have money, and that's the reason why I didn't present early. But what I want you to know is that the delay is rather expensive. When it comes to dental issues, the longer you stay in the house, the higher the price. So if you come early, it's cheap. Sometimes the treatment is done free. Because it's not something we can actually charge you for. So anything, just come and talk to a dentist, and let's see how we can go about it. We have support funds, we have things to help patients. That is why we are there to help. So just come and let's see. Okay. Bye-bye. Thanks for coming.
The expert herself, she says, just come, see your dentist, and they are willing to help you. Dentist appointment is not as expensive as you think it is. It is not. So she's asking all of us to come, have consultation, let them help us so it doesn't get complicated. All right. It's always good to hear from the expert on the field. She's made it very clear and very straight to the point. Once again, on behalf of myself and everyone else on the call, I want to say a very big thank you to you, Dr. Mrs. C.S. Kenyako. We appreciate you so much and also for accepting our next invitation. We are happy for that. So once again, every one of you, thank you very much for joining us. Well, I appreciate all of you. For those who join us late, I'll be posting the recording shortly. Thank you very much. Subscribe to the YouTube channel and put the notifications button on. Share the link, share the YouTube channel. Have your friends subscribe so that they can also go and benefit from the free health education. Our aim is to reach as many people as possible. And through your help, the YouTube channel is growing. We have over 1,000 subscriptions now through you. And these are all organically grown people who have joined and subscribed. Thanks to you. Keep sharing and let people join to see and benefit from what the experts are saying. It's been another wonderful weekend. And this brings us to the end of today's episode. I appreciate you all, including our guest speaker. Till I see you again, it's been a plum pleasing pleasure serving you all. Enjoy your morning, afternoon, evening, depending on when you get to watch this video or wherever you're reaching us from.